Guys, welcome back to Medical Coding with Blue. Today's episode is all about, is medical billing and coding a good career choice for you? If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Typically around this time of year, I get a lot of questions about what all goes into this field and what all do you have to know, and is there math involved in this field of medical coding? So I'm going to answer those questions today. So here we go. Okay, first things first. When it comes to math in medical coding has to do with plus, minus, multiplication, division math. It is very easy, everything that you can do on a calculator. So there really is no need to panic. Billers do have to do a little bit more math. Of course, they have to do percentages and of course, plus, minus, multiplication, division math. And again, it's very easy just plugging in numbers and just using a calculator. It's nothing that is too strenuous when it comes to math. People who think that medical coding involves a lot of math are confusing it with software coding, and that is not what we do. That's the first thing out of the way. But one of my viewers suggested, and shout out to Court made the suggestion, that if you are interested in pursuing the field of medical coding and you want to know what it is before you start buying a program or before you start buying books and getting into it, there are some free resources out there so that you can get an idea of what you're going to walk into. Now, CMS, or the Centers for Medicare and Medicaid Services, offers a free downloadable resource called for the ICD-10 coding guidelines. You can download them for free there. I will leave that link in the description box below. Please do not ask me what is the link because it is in the description box below. So you can click on that link and you can download them yourself. You can take it over to the UPS store or any place that does copies, and you can get it copied if you'd like. It is 115 pages, but only because these are the rules and of coding, of the diagnosis coding. And it's the font size is a little different from the book. If you have your ICD-10 book, which all ICD-10 books, which is the diagnosis coding, offer the guidelines in those books. But CMS offers them for free for download, and they're going to be the most current every year. And because it comes out, they have it uploaded. But you can download them, you can have them printed, and you can take a look at them, you can read them, and you can kind of get an idea and a feel for what you are about to get into. Medical billing and coding is a lot to learn. It is not something that is easy. It is not something that if somebody told you, oh yes, the codes are already selected, you're just pushing stuff through. That is wrong. When it comes to medical billing and coding, we, as those stewards of the codes and the records, we have to look at these and make sure that the codes that are being selected are correct, whether it is the diagnosis codes or the procedure codes. And we need to make sure that all of those are appropriate, because if not, the provider will end up either losing money or getting too much money, and then now we have fines. The other thing that you have to think about is the patients that are involved. A lot of people get these huge medical bills, but when they have somebody look at them again, a lot of times those huge medical bills are cut down really small because the incorrect code was selected. So again, this is a part and a very big responsibility for medical coders and for medical billers, if that is their function, to do so. So that is something that you do need to know. Medical terminology and anatomy are huge parts of this as well. You do have to learn those things. If you have no background in medical, it is okay. A lot of us came in to medical billing and coding with no previous background. So you do not have to be a nurse. You do not have to have a degree. You do not have to go to a formal program. I do have on my channel the independent study list. It's got the whole syllabus with all the books that you need and the links and everything. I give this out for free. It is there. All you have to do is just follow it. The typical time it takes to study for a career in medical billing and coding is 9 months, 12 months, or 18 months. There are a lot of programs out there that are less time than this. There are some ridiculous programs that are 2 months, some that are 16 weeks, some that are 6 months. And that is entirely too fast for the amount of information that we have to have. And it does not matter if you've come from the medical field before. I have had many nurses that I have trained, that I have tutored, that I have coached, and a lot of them struggle as well because medical coding and the whole industry of health information is a completely different language. We have our own set of rules, and we have to know what doctors know while never having gone to medical school. We have to interpret and read everything that they document and really understand, because the doctors are not obligated to use the words that are in our book in order for us to pick up codes. So even if the doctor uses some weird obscure word and it equates to a code that we have in our book, we can totally pick that up. But we have to understand those really weird, obscure words. So if English is not your first language, this can be difficult. But I have had many people who write in who say, English is not my first language, but I'm working on my English so that I can get better with medical coding. It is very important, because English not being your first language is not an excuse. And although some people will say, well, English is not my first language, so I didn't know, it doesn't matter. When it comes to medical billing and coding, that is imperative that we always select the correct diagnosis. And yes, while we are human and we do make mistakes, you're not expected to be extremely perfect, but you are expected to have a high accuracy rate. Now, this accuracy rate will come with time and practice, but that is the whole part of it. You have to study and you have to practice. And yes, when you get done with school and you prepare for your test and you take your test and you pass your certification exam, you are going to notice that every employer is not going to sit there and welcome you with open arms. There's a lot in this industry to getting in. On my channel, I talk extensively about steps and things that you can do in order to get in. This field is not for the faint at heart. It is definitely not for those who give up easily. When it comes to this career field, you have to want it, because it will put up a fight before you even get in. It will knock you down. It will you'll take hits on your ego because you're going to wonder, do you know anything? When you go through that gamut of the school of learning, right? Or if you're learning through a school, or if you're learning on your own, you are going to find out really quickly that you're going to question your own intelligence, especially when you start learning medical terminology and anatomy. But these are things that will grow with time. And it does get easier. Again, if you look through any of my videos, you'll find medical terminology videos, study videos, and videos telling you how to set up a schedule so that you can get disciplined enough to get on a schedule when you're trying to learn. A lot of people don't want to put in a lot of time. They say, well, Blue, I want to hurry up and get my certification so I can hurry up and find a job. But if you don't know what you're doing, you're going to find out really fast that it's going to be even harder for you to get a job. We do have to take an assessment test when we are out there applying for these jobs. And sometimes people will take assessment tests because the employer has to be able to gauge your skill and your knowledge, right? If they're going to take a chance on you as a brand new medical coder, and they say, okay, we're going to give you this test and we're going to see what you know, you have to do really well, because even if you get an 80 or an 85 or a 90, they could still consider that a fail grade. And only because this means you need a little bit more work. Sometimes they will tell you what you missed, and sometimes they will not. And sometimes you just won't even hear from them. But it's important not to take this stuff personally. The reward at the end is getting into this career field and making it a lifelong journey, because that's exactly what this is. I am a 13 plus year veteran. I've been a medical coder since 2008. I started off with a certified coding associate, a CPC-A certification from the American Health Information Management Association. I currently have the CCS, the Certified Coding Specialist, and the Certified Coding Specialist physician-based credentials, also with the American Health Information Management Association. My CCA has been since retired because as soon as you get a different credential, the CCA gets superseded. And that is just a thing with AHIMA that they do, is when you get the CCSP or the CCS, that the CCA is essentially dissolved, only because it is considered the entry-level credential. Now, this entry-level credential packs a punch, and people who have this are actually more powerful than a lot of people give them credit for. There's a lot of trash talk in this industry that I really wish people would stop doing, because if you're saying that the CCAs don't know anything, you clearly don't understand what it takes to get that credential. People who have the CCA know and they're proficient at inpatient coding and outpatient coding. And that takes more than a wink and a smile to be able to do, because this is two different types of procedures that they're being tested on. CPT, or the current procedural terminology, and ICD-10 PCS, which is a completely different procedure code set. And that ICD-10 PCS is for the inpatient side of the house. The CPT, or current procedural terminology, is for the outpatient side of the house. Most medical coders, when they go through programs, are being trained in the outpatient setting. But there are some programs that do offer both inpatient and outpatient training. So that's when you can get a entry-level credential like the CCA. Okay, so again, I had it for many years. I will always advocate for it. And I hope on my platform that more and more people understand what this credential is, how great it is, and how useful it can be to have somebody with it on your staff. I'm just saying. So that's something you ought to know. The other thing that I want to talk about, if you are researching this career field, is to choose carefully where you get your information. If you are listening to the school and the recruiter and them telling you that you need all of these credentials, and once you get your first credential, then you immediately need to sit for another credential, you do not. When it comes to being a brand new medical coder, all you need is one credential. And I challenge you to look at the job listings and see if you see any employer asking for multiple credentials in order to get a job. When you take one of the 4 main medical coding certifications, again, all you need is one. The Certified Coding Specialist, which is the gold standard of medical coding credentials, the CCA, the Certified Coding Associate, the CCSP, the Certified Coding Specialist Physician Base. These are all with the American Health Information Management Association. Or if you choose to go through the American Academy of Professional Coders, they have their flagship credential, the CPC, or the Certified Professional Coder. When you have no experience in the health information industry in the beginning, you will have the apprentice status on your credential for the CPC. AAPC is the only one who does this. AHIMA does not do that. But when you get one of these 4 major medical coding certifications, this says that you are competent in the specialties, the specialty coding, right? That you understand how to code for mother-baby, for neuro, for ortho, for cardio. It tests you on everything, okay? So it is unnecessary to tack on additional credentials that are subspecialty, because again, nobody asks for those. I am a subspecialty coder myself, but I do not hold any specific orthopedic or podiatry credential. Why? Because I've already showed proficiency with having the CCSP and having the CCS. Because again, all of that stuff is covered on those exams. So save your money and don't get sucked in. And do not allow yourself to be taken advantage of by these schools, because remember, they are a business and they're trying to sell this business. Brand new medical coders, it doesn't matter if you don't have a job yet, you are still responsible for the upkeep of those credentials. And these credentials do require an upkeep. It really all depends. If you are with AAPC, they do require you to pay a yearly membership fee every single year that you hold your credential. Not only that, it is 36 continuing education units for one certification. And while AAPC does offer some CEUs that are included with your membership, It does not cover all of the CEUs that you need to be able to report. And if you are with AHIMA, the American Health Information Management Association, they do not require you to be a member of their association every year. However, they will require you to pay a separate fee for reporting your continuing education units, which if you are with them and you have one of the three, the CCS, CCA, or the CCSP, it is 20 for one certification. 20 CEUs for one certification. So you really need to think about what you're getting into, which association you're going with, because it does impact your bottom line when it comes to the money aspect of it all. How much money you're going to have to spend every single year in order to maintain or to keep your credentials current. So another thing to think about. Now, if your program says, oh, we train for the CPC, it does not mean that you cannot sit for the CCSP, which is the AHIMA's outpatient credential equivalent to the CPC, because CPC is all outpatient coding. If you did not want to go through AAPC and you want to go through AHIMA, you could take the CCSP, Certified Coding Specialist Physician-Based Credential. And again, it's all outpatient coding. There are some different domains that are on the testing for the CCSP, and you can take a look at the ahima.org website. Again, I will leave the link for the website in the description box below, so that way you can check out those specific domains. So you can always attend a program that is for AAPC, but then study on your own for the remainder part that is going to be tested for the CCSP if you wanted to sit for the CCSP. That's just my advice on that one. But it is a great and rewarding career field. It is not easy though. And I don't say this to scare folks. I say this to prepare folks. And there's some people that get upset, and that's okay. If you get upset and I told you something you didn't want to hear, well, that's just life, and that's the way that things go. But I would rather somebody tell me the truth rather than lead me and make me think that this is going to be something that is, oh, it's so easy and I can travel and I can stay at home. When you are starting in this industry, you need to be in the facility. You need to be around other medical coders, because you'll find out soon enough that book coding and real world coding are two different things. And once you start getting exposure to the electronic medical records, every facility has a different electronic medical record, and they all function differently. And even two different facilities who use the same brand can have two different packages. So the navigation will be different for those electronic medical records. Again, something to think about. But yes, it's a lot of learning. It is not impossible. It takes a lot of discipline, but the reward is so great. The reward is that you get to work with some fantastically intelligent people. And if you are coming from a background of like working minimum wage, I worked minimum wage for many years. And I I worked as a bartender. I worked at a halfway house. I was a housekeeper. I did all of that before I became a medical coder. And the just a difference in where I work now and what I used to do, it is just so night and day. And I like the fact that I work around such fantastically smart people, and they're very quirky, these doctors, and they have their own way of doing things. They have their very interesting personalities, but it keeps things interesting. And I'm an advocate for them, and I'm an advocate for patients as well. As far as like, I always make sure that my knowledge is up to date, and my knowledge is always reaching, trying to figure out new things and learn new things. I still continue to study 20 hours per week. And that's on top of my channel, that's on top of my job, that's on top of everything else that I do. I still manage to squirrel in the learning. And that is something that will always constantly be. If you want something that is easy, this is not it. If you don't like reading, again, you're not going to want to do this, because this is all reading. We read 90% of the day. We communicate with providers the other half of that, the 10% that's left of the day. Sometimes it's a little bit more. It really all depends. But we do not have patient contact. We do nothing with patients unless you are doing the billing and you have to talk to the patients. but we do not have any hands-on patient contact. We don't do any of that. We basically are working behind the scenes. People will never know who we are, but we do have a huge impact on a facility's ability to gain revenue or lose a lot of revenue. If the coding is being done incorrectly, well, the facility can lose a lot of money. Okay, so that does fall on us. And again, it goes back to studying your books and being very proficient at that. At least that's just my advice anyway. But yes, if you are continuing to do your research, please look through my videos and see if this is for you. I've gotten many messages where people said, thank you, Bleu, for telling me this, because somebody else didn't tell me. And now I know I can make an informed choice. It is about making informed choices. It's about doing your research. That's all part of being a medical coder, okay? I'm just saying. So, best of luck to you out there. And if this video helps you, I hope that you will like, subscribe, and share. And I will see y'all again. Bye.